Before I biked over to work this morning, I wanted to give an update from the video that I made last week about the DC all the time, inside, outside, wear a mask mandate. And this will probably be my last video that I talk about like coronavirus. I think I've said that before, but in actuality, it hasn't been that bad of a time for me. I've been working in my office since April. I took a bike trip from Pittsburgh to DC, which I am going to try and make that an annual trip, so I got a chance to do that. I've even made a little money in the stock market on coronavirus stocks, and honestly, it's just been mostly a little bit of emotional turmoil, a little bit of frustration from what I considered, the public health officials or certain sides of the media and government either lying to us or just being inept. And so that's what's bothered me. And the realization that there's people out there that are subjected to some of this stuff that already have a really difficult life, and you're just kind of piling stuff on top of the problems that already exist in their lives. And then of course there's a concern, a health concern, a little bit of a concern for me, not much, but definitely for other people, because it is a new and deadly virus, and that's a sad thing. So last Wednesday, Muriel Bowser made this mandate of masks all the time in DC, inside or outside. When you're walking your dog by yourself, or you're standing on the corner waiting for the bus. And it must have been either miraculous mandate that fixed the problem instantly, or who knows, but the day that she made that order, there was only 40 new cases, which was what was happening the weeks before. And then it jumped to 102 on Tuesday, so they made this order, right? Well, on Wednesday there was 40, and then the following week, there was, the following days there was 70 and 60 and 70 and 80, in that number. So no real spike, no surge of cases, and it didn't have anything to do with whether or not people were wearing masks outside, because frankly, there's no evidence that people are spreading the virus outside by not wearing a mask and breathing and talking, just passing by each other. Now, in that same briefing, she went on to say that the director of DC Health, looking at the information, the data, didn't find definitive evidence that eating inside or eating out in general was an increase to the spread. But I've been eating outside, I've been at places, you can just look at the groups and you can instantly see a group of 3 or 6, you can see that they're not from the same household. Now let's talk about the likelihood of the virus spreading. In places like eating places where you're not wearing a mask and you're with people from different households, that is probably what, if there is an increase in spread in places, those are the sorts of things where it's possible that it would increase. The people from different households spending extended periods of time eating and drinking together in close proximity, and then who knows whether or not their servers don't always do a great job of having their face completely covered in some of the places that I've been. So that has been a little bit troubling, but again, I don't think I have the virus, so I can't spread it to anyone. But I know that I haven't had it up till about the end of June, but because I didn't have antibodies when I got my antibody test done. But yeah, the restaurants are way more likely, and there's probably evidence of it spreading when people are eating together, outside or inside, because you take your mask off and you're extended period of time with people outside your household. And we all know that social distancing only works when you don't spread it to people in other houses. And we can't say that right now.